Good evening, everybody. We have about a minute to the webinar, so we'll give everyone some time to come in. We'll be starting at in about 1 minute, 5:30 Pacific, 8:30 Eastern. And I see some users joining in here. Welcome. Hope you've had a good, productive Wednesday. We're happy to have you join us at the end of your long work day if you are working today, or if it was a day off. Even more appreciative that you're taking the time.
Yeah, great. Awesome.
Right.
We can see lots of people right now logging in. Thank you so very much. And I know for some of you, if you're back on the East Coast or even some international, the time is a bit later. So we really appreciate you joining us this evening.
Yeah,
and we will get started shortly.
We will. We're excited about this webinar. I mean, paperless is something that has been a trend for a while, and we see a lot of half-hearted solutions here and there, and we see a lot of integrative plays and just still back and forth and some extra work that we think we can help eliminate for a lot of you out there.
I will be so bold as to say, we don't think we know. We have some really great technology to show you, and very excited. And I think we can convince you of some of the brilliance of this technology in the cloud. So.
And I see that we have some dial-in phone listeners as well. So during the point where if we go over any screen recordings and videos that you won't be able to see here, we have this webinar recorded. So you'll be able to access the video of it and see any of the recordings that you aren't able to today. So, or even if you are seeing us on video today, just want to revisit, we'll be sending out that link after the webinar. The Q&A is at the bottom, so we welcome you to put in any questions as we're going along. I know sometimes they're easier to remember as they pop up in your head. We'll collect them until the end of the webinar to answer all at once. And of course, if we don't get to your question by the end of the webinar, then we'll be more than happy to reach out and discuss with you personally.
Yeah, but please get your questions in, because we love that opportunity at the end to address those and answer. And of course, some of you may be a little further along in your process of evaluating software and paperless options. And so some of you might want to be cutting to the chase. So let us know, and we can reach out and answer those questions as well.
Exactly. Now, before we dive into fully paperless and the benefits and the how-tos on getting started, I wanted to preface by saying that over the course of this next few minutes while we talk about paperless, we don't just mean eliminating the physical paper in your dental practice, because yes, that is a big part of it, but also what we'll be talking with you about is improving the entire workflow and experience in your practice for both the patients and the team. Because while you can cut out the steps and cut out the paper and those physical tools, there's a lot of intangible benefits to this new digital workflow that we'll be going over today. And without further ado, we are joined today by Mr. Ken Kingsbury, a practice management software expert of over 35 years. Ken started his career with Mac-based systems and is a huge expert since 2000, and even before that, working on practice management software and management consulting in the practice. And today he's working with cloud practice management software and helping practices transition to the new age of doing dental work.
Thank you, Tiffany. And I'd like to introduce Tiffany Nguyen as well. It didn't take her 35 years to accomplish quite a bit. She's managed lots of multiple location dental offices, is an expert in practice management and cloud. She went on to get an MBA in technology. I've learned a tremendous amount from her. And then in her spare time, she managed to co-found Asprodental, which is a cloud-based system that really attracted my attention. and I'm very excited to be on this call. I learn something every time she presents, and so without further ado there, I'll let Tiffany take it on to the next.
Well, thank you, Ken. Lots of positive words there. No pressure, right?
No pressure.
So paperless is what we'll be talking about transitioning to. But what are practices currently doing? So between Ken and I, we talk to a lot of dental practices across the nation, and we get a sense of what they're currently doing in order to help figure out what would save them time and money. So a lot of the current workflow that we see includes filling out paper. So a lot of practices will still print out their paper forms and give it to the patient to fill out in the practice. They'll scan it in and then upload it. There's the pre-filled forms where some practices will have the forms on their website and have the patients print them out and fill them in, and the office in the practice will retype the information, scan in the form, and upload. So in a way, because the form is online, it's somewhat digital, but a lot of patients don't have printers at home these days. As we talk to different offices, we start hearing that it's becoming more and more of a trend that people can't print out their forms. They actually don't have printers. Even if the patient were to fill it out as a PDF electronically and send it back to the office, there's still that issue of retyping the information. So overall, the current workflow, no matter how you cut it, has a lot of busy work. And the biggest downside of paper is that lost time associated with the busy work. And in addition to having to retype information, if you have a form on paper or if you don't have it directly in your practice management software or somewhere that you can pull up quickly, is that it cuts into the appointment time. So this one-on-one time with the patient is hugely valuable. The better impression you can make with your patient, the better the relationship, better the treatment acceptance. It just improves their entire patient experience. Now, here's a quick story. I was at one of our client offices long before they were switching over to digital. This was when they were still thinking about it and still planning for it. They do a lot of pediatrics and family dentistry. So for the teenagers, it's a lot of ortho and Invisalign. And at that age, it was a little bit different when I was really little, but the kids now are very actually excited to get their, whether it's braces or Invisalign. Invisalign's really cool, so they are really excited about that too. And you can see the progression of the visit as your patient comes in. They're really excited to get their brackets on or to get their first Invisalign trays. And the dental practice greets them with this packet of paper to sign off on consents to either place a bracket or consent on movement of teeth with any type of orthodontics. So now this patient who comes in super duper excited to start their dental appointment is sitting with mom or dad, looking through these papers, initialing them, signing them, and by the time the patient goes up back to the front desk to hand back the papers, the tone of the appointment is a lot lower. So now when the patient goes back to the doctor or the dental assistant, they're getting the patient at a mood that's slightly lower than if they had just been able to take the patient straight back in, had the patients fill out the form beforehand, for example, digitally, and could welcome them and start the process right away. So just there itself, you can see it's a lost time with paper forms and in-office forms, but also a potential opportunity cost of that impression that you can make with the patient right then and there.
Yeah, I like to just share quickly. This is true story. Just happened a week ago. I had to take my mother in for 2 extractions. She got the information initially sent as an email, and she had to figure out, she's 93 years old, she had to figure out how to get that email back over to me with the attachment. I had to then open it up as a PDF, get in and try to fill that information out. Meanwhile, she's stressing because she is not there to sort of supervise that piece of it. Then you go in with the printout of that, have to sit for 30 minutes to go through that with the front desk. Same thing all over again when she actually came in to get the extractions done. So the amount of time is very consuming. The stress levels can be there. And yet my 93-year-old mother can pick up an iPad and navigate it very easily. So you're going to be seeing how simple it is to get all this information sent to a phone, to a tablet, to an iPad, where a lot of people just know how to point with their fingers and navigate, and incredibly simple and incredibly time saving as well.
I think on the patient perspective, it's very clear that if they could get a link and just do something very quickly from the comfort of their own homes, that is without a doubt preferable. Or if even if it's in the practice, if it takes very little time and they don't have to wait for the front office to retype the information, even that in itself, while it's not before the appointment, it's still a more pleasant visit in the practice. Now, on the team side, that means decrease typos, because deciphering handwriting, right? Not is it an E, is it an A? And all of that busy work time is also decreased. There's also the cost between pen, ink, paper, clipboards, toner for your printer. Toner, $80 a month. That ream of paper, $25, $30 a month. If you use a shredding service, $50 or so, or you shred it yourself and you have your front office sit there for like 15 minutes every day shredding paper. That cost is your time, essentially. And then, of course, with now sanitizing pens, there's an additional step that you have to do too.
Right.
Another downside, it's just simply outdated. If we have digital forms for pretty much everything out there, we can sign everything on DocuSign online. And now if you come into a dental practice where you have, let's say you have a milling machine for a crown, a CEREC in office. Let's say you have a 3D scanner. Let's say you have all of these cool new gadgets, and then you're still greeting your patient with paper. It's a big mismatch there, and it changes the perception of your practice too. And of course, hygiene, which right now more patients than ever are paying attention to. So right now, quick story, another story. I was in one of our practices, one who's actually using our product for the electronic consent forms. And I was sitting in the waiting area. A patient comes in. She's fully, this was about, I don't know, half a year ago or so. So she's fully masked up and face shields, and she has gloves on. So she's gone all out, right? There are patients like that. And the office asked her, did you fill out your forms? And she goes, oh, I didn't have time to, but I brought a pen. I brought my own pen to use. And the office goes, well, actually, it's digital, so we can just email it to you. And she goes, oh, that's great. I can fill it out on my own phone, and I'll sign it right here. And that way I don't have to touch anything in your practice. And of course, this is a very hygienic practice and they sanitize everything, but there are still patients who are just very cognizant of the world around them and want to keep to themselves as much as possible. So that caters to everyone in the practice. It gives you just one extra perk. Now, the upside of paperless. So we talked about all the ways that having paper in your practice can bog down your workflow and the patient experience. Now, the upside of going paperless is fully digital. First one is that patients prefer it. Resoundingly, what we've heard through all of our clients is that they genuinely do prefer it. Maybe the first time they're filling it out, they're not used to it and they're thinking, oh, this is new. How do I do this? But we'll show you right here how easy it is for a patient to fill out an electronic form. And they actually have told the practices who have then told us that they prefer filling it out at home when, let's say for a health history, you have, as a patient, you have your list of medicines that you take at your home, easier to copy over than if you were in a practice and had to recite them from memory, for example. You can do it in the car while you're waiting before you come into your appointment. And generally what we hear is that it is a lot easier when they know what's coming into the appointment and can prepare for it. So here's a quick video of how the patient can fill out this form online. So this is the patient's email, and there's an encrypted link that goes to a page where they can fill out their address. So here's the patient intake form. Address, city, state, phone number, email address. You don't have to decipher their email address or phone number. Custom questions that you can add onto their profile, conditions or allergies, and the ability to go through, and if you haven't, and put in custom allergies as well. Any medications, you can choose none or select one. That's a liability thing to cover for the practice as well, to make sure that they're actually choosing none if it's nothing versus an actual condition or allergy if it applies, the patient's signature, and save. So that there is from the patient's perspective, very straightforward, very easy to do. And surprisingly enough, we talk to practices that see entire families, which means anywhere from the child, where it's normally a parent filling out the paperwork, all the way to the elderly. And of course, there's a certain age at which maybe someone may not use their email that frequently, in which case they can still come into the practice and the front office can help them go through and type in the information on their behalf. But for most patients, they have access to their email, and it's a lot easier for them to do on their own time with less pressure.
Right.
And this also saves time for the team, because as you saw, the patient entered their own information there. And as soon as they clicked submit and signed their form, it goes straight into their digital profile or digital chart. So it's one less step for the front office to either scan or retype. And that time that's saved can be refocused for the front office staff on other things that can actually bring in more production, more revenue, more work for the team. For example, reactivating hygiene patients that are overdue, following up on treatment that hasn't been scheduled, or just anything else that isn't scanning and retyping.
Yeah, I'd just like to add that savings of time is not just about the productivity opportunity. It's also about sort of the general health of the team in an office. When I've been in a lot of offices in my time, and frustrations of having to scan and file and shred and track down and put things inside of charts and all that can create a lot of just weariness around those processes. And so by eliminating these things with a very streamlined paperless approach, you're helping keep the health and the attitude of the team at a very positive level.
I agree. And speaking of the team, from the front office to the back clinical team and dental assistants, anytime a patient fills in their information, you can view that information beforehand. So if you're sending out these links to the patients to fill out their intake forms and health information prior to the appointment, maybe 2 or 3 days beforehand, then the day before you can look through your patients for the next day. Or you can, in the morning, you can look through your patients for the rest of the day and see immediately what conditions they have, what allergies, what medications, and start prepping for those patients. Anyone who needs to pre-medicate, make sure that they take their meds before they come in. We hear all the time patients who need to pre-med forget to, and then there goes your hour or 2-hour appointment that you have reserved, right? So a lot of this prep work that you can do to be more prepared for appointments always makes things go smoother. And here is from the dental office perspective. So when we sent the patient that email link, that's all you do. Click send patient info, and it sends them that email from a few screens ago. And here on the health history tab, when the patient fills in their information, it shows the updated date and all the information that the patient typed in their form, along with their signature at the bottom. So by checking the last updated date, you can make sure that the patient signs everything. And you can see here their address that was filled in the form gets automatically put in to their profile as well. So that's one less step, like we keep saying, as we eliminate as much busy work as we can.
Yeah, I just want to keep emphasizing this is real time. We've talked to a lot of offices where I think the latest office we just talked to, using another service on top of his practice management, he said he'd have to sync it and then wait 15-20 minutes for it to catch up to get back to his practice management. As soon as the patient confirms, it is immediately inside of their account. Mm-hmm. So there is none of the syncing, none of the waiting, which can be really frustrating in an office that's moving quickly.
Yeah, and I think that can fits right into it. The modern way of doing things is to have things be seamless or easily accessible at the very least, right? Having to wait 15 minutes for something to come over is there, that's a big lag time, you know. Part of having a modern system is that you should be able to search through it. So for example, all your consent forms, you should be able to search and say, you know, fillings to see all the consent forms of fillings that were filled out. And it seems standard and very basic if we talk about it out of context. Like, yes, you can search through your email, you can search through your phone. Why not search through your practice management system or your where you keep your patient records, right? But for a lot of programs out there, this still isn't a standard because, I mean, actually, I don't know why, but that's part of what we're talking about is the ease of accessing your own information, the data that you created as a dental practice. And on top of that, patients really do think it's cool. We've had practices tell us that literally verbatim, they would say, yeah, our patients say it's cool. So that's never a bad sign, right?
No, modernizing the practice does nothing but add a layer of confidence
Yeah,
with an office, that keeping up with technology and all of that. And so there's a lot of advantages to the modernization piece.
I agree. And with the search, where I was saying you can search through your consent forms and search through your electronic forms, being able to search through your progress notes is something that is an extension of that. And I'll show you real quick. It's kind of a side note, but here, if we put in a clinical note and write in, you know, we're putting in the notes. But let's say, for example, here, how did the patient chip her tooth, right, on an almond? Now, if it's been a few years and we're looking for that note, we don't remember exactly the date or the tooth number, but you do remember typing in that it was chipped on an almond, you can search for that and pull up your progress note that has the word in it. So this
That's
goes,
remarkable. I just want to say, as a guy who's been doing this for 35 plus years, that's remarkable.
yeah, and you can search for other things like if the patient did something to their tooth on vacation. Um, it's and this is carried through, like I said, to the consent forms as well, or to your scanned documents. So if you're uploading EOBs, for example, if it's a Cigna EOB, you can search under one patient for, you know, Cigna, and it'll show you all of the EOBs under Cigna. And it's just a lot easier of a way to run your day. Um, so more hygienic, I think we covered this, where the patient can use their own devices. Even if they do use the office device, we have a lot of practices who have iPads and a lot of practices who have Chromebooks. Chromebooks probably run a little bit cheaper than iPads do. iPads also look really nice and sleek. Either way, just anything touchscreen. We see from tablets to laptops, and people buy all sorts of cool devices when they go digital and have a touchscreen signing area for their patients in the practice, because it's just exciting, I guess, to fill your practice
More
with some
intuitive, just
things.
more intuitive way to interact.
Yeah.
With this.
And a lot of patients, no matter the age, if you hand them a device that has the signature box right there, they can draw their signature, and it's just one thing to sanitize, and it's actually very easy. Here is a consent form. So let's say we're sending a patient a consent. Here on the left side is from the office perspective of how to send the patient a consent form. And then I'll show on the right from the patient's perspective, pulling up the consent form on their email on their phone. But of course, this can be done in the practice as well. Here we go. So you click on consents, and then you'll look for the consent form that you want. Again, it's a search. We have standard forms from TDIC in the system pre-populated, but of course, every practice has their own custom forms sometimes. So you're more than welcome to upload your own, edit them. It's very easy. And here is send to email. Now, actually, I'll rewind a little bit. I can click send to email. That will send it to the patient's email. If I click sign now, then I can do anything that I show you on the patient screen, but from the office. But in this example, we're sending to the patient's email. So send to their email. And then here on the patient side, they receive an email with the link to their consent form, and click on the link, pull up the consent, sign with their finger on the boxes, hopefully read it a little bit more thoroughly than this demonstration patient,
Reading.
and then submit. And in real time, from the practice's perspective, oops, go back, we will go to the documents tab for the patient. Nope, okay, there we go. Documents tab on the patient, and then in real time, the consent form gets pulled in. So here is the form that the patient signed from the right with their signature on the bottom, and it's saved in a PDF so that you can print it or anything that you need to, but it is right here in the patient's chart in this documents section where there's no printing or scanning required to get it there. It just goes straight there as soon as the patient fills out their form. And this is
all in real time. It's real important to just keep emphasizing that, because that's not common with a lot of these systems out there.
Yeah, exactly. And for patients who have busy schedules, that works really well too, because they can just do it in between where they're standing in line somewhere. And of course, and another upside of paperless is that it saves money. So everything in terms of time savings comes back to money savings as well, because the more time that you're not spending doing these miscellaneous tasks, your team can spend doing office production activities and bring in more revenue for the practice. So getting more patients in, more outreach, and in addition, the patient forms coming in before the appointments can help you prepare for your day even better and make these appointments go smoother, and perhaps even free up some time for, I don't know, care calls or seeing additional consults or anything like that.
Yeah, it's definitely a paradigm change, because you will be creating time. The bottleneck becomes far less intense in a practice when you can smooth out those paper processes and create. So it's saving money, but it's also creating revenue. It's a brilliant combo.
Yep, it's an extra perks, double whammy, right? What about the patients who are really busy, right? The patients who you want to present them their treatment plan for their next visit, but they're running out the door. So here you can still present that treatment plan without, rather than your front office putting together their treatment plan, printing it out, scanning it in, emailing it to the patient, waiting for their signature, and then when they do sign, saving it, uploading it to the patient's chart, and then that's the workflow. Instead, front office can go ahead and create the treatment plan rather than print it or attach it or any external steps. They can put in any notes that they need to, figure the insurance amount, and then have the patient sign it electronically if they're in the practice, or by email if they have run out of the practice. But if they're quickly signing it in the practice, then the patient also gets an email copy of their treatment plan so that they can share it with a spouse, with a parent, or whoever helps them with their dental care if they need to. And in the documents tab, it is automatically saved as a PDF with the patient's signature, so we have a record of what they signed for. If the form is emailed, then instead of having the patient's signature right here, you'll get a date and time stamp saying that it was emailed to the patient on this day and that time. And so the automatic filing of the documents into the patient's chart, again, is a huge time saving. If you're still using a lot of paper or third parties where your front office has to upload things, it doesn't come off as a lot of work when you think about it, because it may be 30 seconds, a minute per patient. But go ahead and, I'm just curious, ask your front office what they think, because sometimes they can't do all of the printing and scanning needed for patients as they come in on that basis. The phone might be ringing, there might be another patient coming up and talking to them face to face. So this leads to a backlog where they could be, at the end of the day, uploading all of these things and spending a lot more time than they need to be doing that. So we're hoping.
I'd like to emphasize one thing too, is that a lot of offices hesitate to go electronic with their charting, which can be relatively straightforward to do your restorative imperio, your chart notes, but it becomes very difficult if the other part of your practice is scanning and attaching and falling behind in that process.
Mhm.
Here you got an opportunity for what can be the most bottleneck part of that process being streamlined, making it very simple to actually look at the reality of going paperless, truly paperless. And that, so that the chart sometimes gets held hostage by all the other things that we have to do still manually.
Mhm.
And so this helps that process. These things are all sort of, sort of co-captains on this process of getting this thing done called being paperless. So I really want to emphasize that, because if there's a bottleneck, it'll stop a lot of other things from happening in the practice as a result.
Thank you, Ken. No, very, very good points. The entire flow of the practice, it's exponential, right? Because if you get held up on the first patient of the morning, potentially there goes the rest of your morning, where everyone gets pushed back a little bit more. Not for every practice, of course, right? But there are days when that happens, and we're trying to decrease the variables and times at which that can happen. So pre-filling forms and making it easier for patient on the front end will make it smoother when they actually come into the practice. Of course, the actual dental treatment and the procedure time and all of that, those are things that we can't always control. You never know what comes up when you actually get in there. But when it comes to the administrative tasks, that is a huge burden that we can take off of the team and the patients if we can make that part smoother.
Yeah, I just want to say before we move into this last part here, is that we're getting lots of questions coming in through the chat. I want to encourage you to, if you have any questions, just type them in. We do have time to, at the end of this, to answer those for you.
So quick recap. 5 ways a paperless patient experience saves a practice time and money. Okay, for all of those who are very good at math, these are more than 5 bullet points.
Right.
I think we planned the webinar around 5 ways, but when it came down to it, it's a lot more than 5 benefits that will take your practice to the next level, simply with eliminating the paper trail and that antiquated workflow. So first off, right, patients prefer it's more hygienic. No double entry from the team means time saved on their end and less potential typo mistakes on the practices side. You can see more patients because you're saving that time. The patients do the paperwork at home, meaning that you get to see their information ahead of time as well, and you're more prepared for the appointments. No physical costs, of course, because it's all digital and everything is stored and backed up in the cloud. Someone once asked me, how secure is having your data in the cloud, right? If it's on the server, you know where your server is, you can see it. If you make a backup of your data file, you can see that file and you know exactly where it sits on the desktop or in the C drive in that particular folder called Office. You know where it is basically. But if it's in the cloud, it's just up there on Amazon Web Services. That's who we use. How do we know it's safe or it won't just poof? And my best analogy is, when was the last time an email in your inbox just went missing? Like if you didn't accidentally click archive or something like that, but it's not really possible for an email, for example, to just go missing. And the reason why is that cloud servers are redundant. There are multiple server farms across the US where your information is stored and bouncing off of each other. So one goes down, it's still up there. And the backups are done instantaneously. So every hour or every set of minutes, a new backup is made and it overrides the last backup. So then you have a constantly updated working version of your data, which when you have a physical copy, it's more of a snapshot in time when you run that backup. So having it in the cloud is very reliable. It's encrypted with the cybersecurity of Amazon Web Services, which is used by reputable companies, Apple, the CIA, I think Siemens.
Kellogg's,
Yeah.
Harvard Medical School. I mean, it goes on and on and on.
Mhm.
One of the things that we haven't emphasized, but it's one of the important pieces, is all that means HIPAA compliance, and it
Mhm.
means taking the pressure off of HIPAA compliance from the office and dispersing that out into the cloud. I just tell you just real quick, as I've been doing a lot of research into this, one of the things that we don't often take into consideration when we go into a reputable cloud software program, is who you're sort of hiring behind the lines there, the people that you don't see. You know, Amazon Web Services, Microsoft Azure, these people hire some of the most brilliant and talented IT specialists that you're ever going to meet, who meet with the CIA, the FBI on cyber, you know, theft and all the rest of that stuff. So you have almost like an entire team that you'll never meet that is actually helping keep your data secure and safe, that none of us could afford to bring into our practice. I mean, plain and simple. And that is the sort of some of the hidden benefits of going cloud that we don't often take into consideration.
And I don't think you would want to bring a cybersecurity person. I mean, engineers are not the easiest people to work with, right? We already have a whole dental team to manage.
Right.
And the business of a dental practice is to produce dentistry, dental work, whether it's restorative, whether it's, orthodontics, implants, prosto. That's what you're producing, right? We want to free up your practice's time to focus on what you should be doing, which is producing dentistry. Your core focus of your practice is not documents management. It's not like that's just, it happens to be a side effect of running a practice, but it's not something that should be taking up so much time in a dental practice where
Yeah.
you take away from spending time with the patient.
Backups, IT, software updates, all
Yeah.
these things are handled behind the scene there, that you don't have to worry about that. Because, if you've been doing this for a long time, especially if you have server-based software, which I represented for years and years and years, those headaches. The stuff you got to carry on your shoulders. Either the doctor's got that pressure, a staff person's got it, or you have an IT person that's not all the time that easy to work with, and adding costs to the practice. So there's so many benefits. We've only scraped the surface on that piece of it, but yeah, this takes a lot of pressure off of the practice.
I agree. So we went over a lot of benefits today and a lot of reasons why going paperless. And when we say paperless, we really mean modernizing the workflow in your practice. But to make it very tangible and understandable for next steps, the paperless step is a big one, a big part of modernizing. But if you're still not convinced that this is the way you want to go, or if you're not sure how this could work or play out in your own practice or how to get started, we're offering a free consultation. So get on the phone with us, get on a Zoom or video meeting with us, explain to us how your practice is currently working, and allow us the opportunity to think through with you potentially where it could save you time and money by cutting out these extra steps and taking things digital where they are not currently.
Yeah, can I just add one little caveat there? There's an opportunity right now that we're offering for a very short period of time, where if you want to try this software out
Mhm.
30 days, we can offer it to you for no cost and no obligation. And this is not a sleight of hand here. This is just our confidence in this software is so great that we are willing to allow people to use it for 30 days at no cost and no obligation, nothing signed, nothing that's going to come back if you decide you don't want to move forward. So this is a phenomenal, I think, chance to try something out that looks as good as I hope that you've seen it look. So you can talk to Tiffany, you can talk to myself, anybody at Asprodental to get the details on that. And then looks like we got a lot of
We do.
questions.
Do you want to dive into questions? I love this.
Go for it.
Okay, so there's one really well-timed question that I think many people may be, it may clarify some misconfusion here. So we have an attendee asking if this is for billing insurance. And okay, so yes and no. The Asprodental is a full practice management software, and yes, it has the insurance billing or e-claims with unlimited attachments as part of it. The product that we're sharing with you today on the webinar is our Easy Paperless product, where we took a portion of our full practice management software and we're now offering it as a standalone product because we got so many requests from potential clients with, they're not ready to move over completely in their practice management software, but really want to start with modernizing their forms and maybe switching over the full software somewhere down the line, which we personally think is a fantastic idea, because then you get your team starting to acclimate to the paperless workflow. And by the time you're switching over your full software a few months down the line, they're not having to learn a brand new system where they already know how to use a big part of it, which is the paperless. But for the attendee who asked, is this also for insurance billing and e-claims? Yes, it is for dental insurance billing. Right now, we don't have medical billing integrated yet, but we have a few standalone medical billing products that we can recommend if that's something that you do a lot of in your practice. And the attachments, dental x-rays and narratives and things like that are unlimited. Okay, so here is a question. My current software does not offer online forms. Can I use your services alongside with my current software? So yes. Yes, you can use Asprodental's Easy Paperless product along with the practice management software that you're currently using. The reason why we offered Easy Paperless as a standalone product to the select few in our webinar and those who were invited today is because of that interest we got in the Easy Paperless consent forms and texting and all that as a standalone with that you're able to use with whatever you're using right now. So we would import your patients list. That way you have your list of patients, their email addresses, their phone numbers, so that you can send them their consent forms and text them through the Asprodental Easy Paperless. What forms can be signed? I saw the HIPAA and fillings, but what else? And then can patient forms and treatment plans. So the forms that we have are from TDIC, the dental insurance company. They're standard forms for all of the usual procedures, fillings, crowns, implants, orthodontics, etc. These forms can be customized by you once you have the Asprodental Easy Paperless product. You can also upload your own forms. It's a simple text field, so it's very easy to do. And we also have the form for patient intake. That was the name, address, phone number, email. And the next page was the health information with the conditions and allergies. So that one as well. Also the medical history where doctor's information and all that. Another form is the treatment plan form. So where we were working from the patient's chart, we choose the procedure from their treatment plan and then show the insurance calculation and their patient copay. And we can sign that in office or send it to the patient to their signature. Let's see. My office manager spends a lot of time to provide a copy of patients' signed documents. How do you handle that? Oh, okay. So you mean if a patient signs a form and they want that form to take home with them. So usually we find that a lot of practices, patients don't really ask for, let's say they're signing off on fillings. They don't typically ask for that consent form of the fillings, but like we were showing in the screen recording, every time a patient signs, it saves it as a PDF. So you can very easily either print that out and give it to the patient if they want a paper copy, or you can export it, save it as a PDF, and email that to the patient. The treatment plan, where you have the procedure with the patient copay and insurance calculation, that whenever a patient signs, a copy is automatically sent to their email, because as we know, patients may not necessarily remember in that amount of detail what work they need done and what exactly they're paying for. So that one we find a lot of patients ask for, and it's an automatic part of the process already. Can the information entered online, such as the medical history, insurance, etc., be imported into other practice management software? It will exist in your Asprodental patient portal, where you see their electronic chart through Asprodental. If you wanted to move over the medical history or profile information, you could retype it. But again, that's the issue with double entry. The insurance information, all that. So you could either copy it over, you could take a screenshot and import it. The main benefit of using Easy Paperless is for the consent forms, where you can send those ahead of time, get them signed, and you have a place online through the Asprodental portal to access them. And if and when you switch over to the full practice management software, that would be your full patient chart where everything is stored and accessed. Do my patients need to sign into a portal before they can see or sign their documents? So no, they do not. In the previous recordings, as you saw, the emails had a link to go to the page to sign the consent form. So all a patient needs to do is click on that link, go through and sign, which is wonderful, because as we know, the less number of steps and the easier something is to do, the more likely you'll get patients' cooperation with that. Let's see, how do my staff know if a request for a signature has been sent? There's a communication log on the patient's profile that shows what has been sent. So you'll see a log there. And I just noticed that we are at the end of our 45-minute webinar time. So I'll answer a quick few more, but any additional questions, please feel free to leave your name and email address. We have you as a registered attendee, so we can always reach out to you afterwards. I'll answer a few more. If there's no real setup, can I try before I buy? Yes, essentially, you can do a 30-day free trial of the software to send out your consent forms and see if that will work for your practice. Can I create my own forms? Yes, you can upload your own consent forms and customize the patient intake form as well. And of course, if you would like to see the program in more depth or talk about specific questions to your practice, please don't hesitate to reach out to us, and we'll be more than happy to discuss with you on your own case-by-case basis.
Great. Thank you, Tiffany. That was great. Lots of great information. Please do reach out. We can do one-on-one presentations. We're always available to meet either by phone or Zoom and answer questions, get more in depth in a presentation. We really appreciate you taking the time, and we look forward to hopefully working with you in the future. So thank you.
Thanks for spending your evening with us. See you on the next webinar.
Bye-bye.